Welcome to this beginner-friendly guide on CT brain interpretation. In this video, we will learn a simple and systematic method to read CT scan brain. By the end of this session, you will be able to identify common abnormalities like hemorrhage, hydrocephalus, edema, and skull fractures using an easy ABCDEF approach. Before you start, or before you looking for any abnormality, always begin by checking the patient's details, confirm the patient's name, age, scan date, and whether the CT scan was performed with or without contrast. Also identify the right and left markers, and these simple steps help prevent interpretation errors and ensure that you are reviewing the correct study. To avoid missing important findings, follow a fixed sequence every time you interpret a CT brain scan. We will use the ABCDEF approach. A stands for asymmetry, B for blood, C for cisterns, D for dilatation of ventricles, and E for edema, and F for fractures. This systematic method is especially useful for beginners and in examination settings. Next, the first step to compare both sides of the brain. Normally, the brain should appear symmetrical. Look carefully for any shift of the midline structures. A midline shift may suggest a mass lesion, hemorrhage, or significant cerebral edema. Also compare the size of ventricles on both sides. Next, look for blood. Acute hemorrhage appears hyperdense, which means bright white on CT scan. Identify the location and pattern of bleeding. Common types include epidural hematoma, subdural hematoma, subarachnoid hemorrhage, intracerebral hemorrhage, and intraventricular hemorrhage. Recognizing these patterns is an essential skill in emergency medicine and neurology. Let us compare epidural and subdural hematoma. The most commonly tested extra-axial hemorrhages. An epidural hematoma is lens-shaped or biconvex and usually does not cross suture lines. In contrast, a subdural hematoma is crescent-shaped and can cross the sutures. Remember this distinction because it is frequently asked in examination and encountered in trauma cases. Now evaluate the basal cisterns. These CSF-filled spaces should normally be visible and open. If the cisterns appear compressed or obliterated, it may indicate raised intracranial pressure or impending brain herniation. Therefore, assessing the cisterns provides important information about intracranial dynamics. Next, examine the ventricles. Determine whether they are normal in size, enlarged, or compressed. Enlarged ventricles may indicate hydrocephalus due to obstruction of cerebrospinal fluid flow or impaired absorption. Always compare the ventricular size with the patient's age and the overall appearance of the brain. Edema appears as areas of low density or darkness within the brain tissue. Important signs include loss of gray-white matter differentiation and narrowing of the sulci. Edema may be vasogenic, commonly seen around tumors or cytotoxic, which is often associated with acute ischemic stroke. Early stroke changes can be subtle and are often missed by beginners. Look for a hyperdense middle cerebral artery sign, loss of insular ribbon, and sulcal effacement. These findings may indicate an acute ischemic stroke even before a well-defined infarct becomes visible. Finally, review the bone window. Examine the skull vault, skull base, and facial bones for the fractures. Skull fractures may be linear, depressed, or involve the base of the skull. Never finish a CT brain interpretation without checking the bone window, particularly in trauma patients. Understanding CT densities is fundamental. Air appears black, fat is dark, brain tissue is gray, while bone appears white. Acute blood is usually brighter than brain tissue and therefore appears bright white. Remembering these density patterns helps you quickly identify abnormalities. When reporting a CT brain scan using a structured format, for a normal scan, mention the absence of hemorrhage, mass spec, midline shift, edema, and skull fracture. And for an abnormal scan, clearly describe the lesion, its location, size, associated mass effect, and an additional findings. A systemic approach report improves the communication and patient care. Let us summarize. Always use a systematic ABCDEF approach. Compare both sides of the brain. Look carefully for blood. Assess the cisterns and ventricles. Identify edema and early stroke signs. And never forget to review the bone window. With regular practice, CT brain interpretation becomes easier and more accurate. Thank you for watching and don't forget to like, share, and subscribe for more clinical teaching videos.